Whether you're dealing with chronic pain, seizures, anxiety, or other neurological challenges, gabapentin has become a go-to solution for many. But before we get into the nitty-gritty details, I want to make it clear that I'm not a medical professional. The information I'll be sharing is based on research, personal experiences, and insights gathered from the community. So, why gabapentin? Why is it prescribed? And what are the key aspects you should be aware of? In this video, we're not just scratching the surface. We're diving deep into the science, the benefits, the potential pitfalls, and more. Before we embark on this journey together, don't forget to hit that subscribe button, ring the notification bell, and give this video a thumbs up if you find it informative. Sharing knowledge is what brings us together, so let's create a supportive community where we can learn from each other. Without further ado, let's jump into the world of gabapentin and explore the 5 must-know facts that could reshape your understanding of this medication. Buckle up, it's going to be an enlightening ride. You want to feel better, so your physician wrote a prescription for gabapentin. You're anxious to take the drug because they didn't actually explain anything about it. So that you can make an informed decision about whether or not to start this drug, we're going to go over 5 essential facts about it today. I need to briefly go over something that comes up frequently in clinic and is really puzzling to many patients before we dive into the 5 must-know facts. That is, there are several names for this drug. Neurontin, Grelise, and Horizont are the brand names, whereas gabapentin is the generic name. Don't be confused by the names. Providers will refer to this drug by both of them. The first thing I want you to understand is how this drug functions. Known as an anticonvulsant, gabapentin functions through a fairly complicated process. The most important thing to remember is that it functions by obstructing voltage-gated calcium channels, which helps to reduce excessively stimulated neurons. This drug shares structural similarities with the neurotransmitter GABA. Benzodiazepines function on the right, however gabapentin does not attach to GABA receptors in the same way as benzos. The second important piece of information is the condition that gabapentin is used to treat. It's noteworthy to note that less than 1% of prescriptions for this drug are written for diseases for which it is truly approved. The majority of its prescriptions are written off-label, and many of those are for mental health issues. The FDA has approved gabapentin for the treatment of 3 conditions: restless leg syndrome, seizures, and post-herpetic neuralgia. Though the list is quite lengthy, the key conditions to be aware of include anxiety, chronic pain, bipolar disorder, sleeplessness, alcohol use disorder, and academics. There are many other off-label uses as well. The third important fact to be aware of is the prescription process for this drug. Gabapentin is available as an oral solution, pills, and capsules, with very varied dosages. The recommended maximum dosage for the immediate-release form is 3,600 mg per day, with the common dosing range being between 900 and 1,800 milligrams in 3 separate doses. Therefore, my usual strategy when starting someone off-label for anxiety with this drug is to start them at about 100 milligrams at bedtime and progressively increase the acceptable amounts to 300 milligrams 3 times a day. The absorption of this drug is not considerably changed by whether you take it with or without food. It is important to remember that consuming an antacid that contains magnesium and aluminum, such Maalox, can lower the concentration of gabapentin by approximately 20%. Therefore, you should wait at least 2 hours before taking gabapentin. My objective is to determine the lowest effective dose of this medicine that causes a full remission of symptoms whenever I take it. Remember that it may take a few weeks for this drug to start working its way through your system. I want you to be aware of the 4th fact, which is the adverse effects. As per the FDA label, the most frequently reported side effects among individuals using this medicine for epilepsy were lethargy, nystagmus, somnolence, dizziness, and ataxia. Now, there are some significant side effects associated with gabapentin that you need to be aware of. First, it can lead to multi-organ hypersensitivity. If, after taking this medication, you start experiencing fevers, rashes, or lymph node enlargement, inform your healthcare provider. Second, it can cause anaphylaxis and angioedema. Therefore, get emergency care if you take gabapentin and have trouble breathing or observed swelling in your tongue, lips, or throat. Third, use caution while determining whether to drive after taking this drug as it may cause impairments. Fourth, there's a higher chance of suicidal ideas or actions. Approximately twice as many patients on anti-epileptic medications experienced suicide thoughts or behaviors as patients on placebo, according to pooled analyses of 199 placebo-controlled clinical trials. Fifth, in children between the ages of 3 and 12, it may result in neuropsychiatric adverse effects. Researchers discovered that children with epilepsy who were taking these treatments also developed mental abnormalities, emotional instability, and animosity. These symptoms mostly manifested as difficulty focusing in school and hyperkinesia, which is essentially restlessness or hyperactivity. Finally, it's critical to remember that gabapentin should be tapered down and eventually stopped. This is due to the possibility of negative effects from discontinuing the medicine suddenly. It increases your likelihood of experiencing withdrawal symptoms, particularly if you've been taking large doses for extended periods of time. The most frequent side effects from abruptly stopping gabapentin include sweating, discomfort, nausea, anxiety, and insomnia. The primary issue, however, is that this drug can heighten the frequency of seizures if abruptly stopped. This is primarily observed in individuals using it for epilepsy. Therefore, before stopping this drug, make sure to speak with your doctor. Before you go, I want to express my gratitude for being part of this community of health enthusiasts. Your engagement, comments, and shared experiences make this channel a vibrant space for learning and support. If you have your own gabapentin stories or insights, please share them in the comments below. Let's continue the conversation and foster an environment where we can learn from one another. If you found this video informative, don't forget to give it a thumbs up. It really helps the channel grow and reach more people who might benefit from this information. And if you haven't already, consider hitting that subscribe button and ringing the notification bell. By doing so, you'll stay updated on our future deep dives into health topics, reviews, and community discussions. Remember, knowledge is a powerful tool, and by staying informed, you empower yourself to make the best decisions for your health and well-being. As always, consult with your healthcare professional for personalized advice. Thank you for spending this time with me, and I look forward to seeing you in the next video. Until then, take care of yourselves, stay curious, and be well.